Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
This segment is frequently asked healthcare questions answered by Health Talks by Baptist Health. The first question is cardiac rehab helpful? It's answered by Rodney Wills of Baptist Health Richmond.
Cardiac rehab is a supervised exercise program for anyone who's had stents, what they call stable angina, open heart surgery, some people call it bypass surgery, and then also congestive heart failure. As long as their ejection fraction is below 35%, they also qualify for the program. Our program is set up to where we do have an exercise physiologist, that's what I am, and we have a nurse as well, so that oversees the program. So we're constantly monitoring, what your blood pressure is, what your heart rate is, and we're seeing the progress. We start from day one. So anyone who's had any of those issues, we definitely can see an improvement strength-wise, endurance, emotionally, physically, spiritually. There's a lot of components to exercise that we can provide here. We have provided a lot of care for many years here at Baptist Health. Our program is certified through a national organization called the AACVPR, so for 25 years we have been accredited in that program. Some people come in here in pretty bad shape, and to see them come in that shape and to leave the program at a different level, they're stronger, they're happier, they're smiling, and they feel great. That's so rewarding for us and for them.
That's great information. And the next question is, what are treatments and screens for lung cancer? That's answered by Dr. Jonathan Fedock with Baptist Health Lexington.
In the state of Kentucky, we're well known for several things, but unfortunately we're also #1 in the U.S. when it comes to lung cancer, both for the incidence of people who develop a lung cancer and also, unfortunately, how many people die from a lung cancer. One of the things that we have that's very strong here at Baptist Health Lexington is our lung cancer screening program, where we try to capture people when they are over the age of 55 or have actually smoked more than 10 years in their life. And if we can use a low-dose screening CT scan once a year, it's been shown that it will reduce the incidence of death from lung cancer by as much as 20%. The basics of treatment that we use for lung cancer have really come a long way in the past 5 to 10 years. The main options of surgery and radiation, they're still our main options. But as far as the surgery side goes, we're now using minimally invasive techniques. These are shorter surgeries that don't result in a long hospitalization. And actually, as a whole, they have much less side effects. And just as surgery has improved, so has radiation. Now, we've been known here for a long time for having our CyberKnife unit. CyberKnife combines robotics with radiation treatments and allows us to deliver a very precise and accurate treatment to these tumors when they're very small, and they actually have a very low risk for side effects. The ultimate goal that we have when we treat here is to make sure we take care of the patient as a whole and have all the treatment modalities available to them so that they have the best treatment with the least amount of side effects, and they can live their best life after we're done.
Great answers, great information. When we come back, the why is here.